having lost 4 with its members who are doctors in this country within 24 hours. For their respect, we want to ask that we observe a moment of silence for our lost colleagues. Thank you. Today, the 15th of November 2020, Kmpdu convened an emergency and special National Advisory Council with membership of the leadership drawn from across the country to deliberate on the COVID-19 situation and the welfare of the healthcare workers, more particularly the doctors, who work a day and night to ensure that the welfare of Kenyans in terms of health is taken care of. We note with concern that the political class and the leadership of the country has assumed and neglected the plight of Kenyans. We are seeing cases of COVID-19 rise. At the same time, we are seeing political activities continuing as if nothing is happening. Every day, the Cabinet Secretary for Health announces numbers of those who have been infected from COVID-19 and equally gives numbers of those who have died. And our worry is, do these numbers make any sense, or we're just counting the numbers of deaths? And with that, Kmpdu has made very strong resolutions to guide us on the way forward. But more importantly, we want to question the leadership of this country that their political activities are increasing the numbers of COVID-19 cases, who go to overstretched health facilities and equally increasing the burden of the doctors in the facilities, who continue to work with very minimal support from the government. And the resolutions made today, I want to invite the SG, Dr. Machonda, to read the resolutions and inform you on the way forward and which direction Kmpdu is taking. Karibu Machonda.
Good afternoon, members of the Fourth Estate. We are still stuck in morning, I think, because some of us have been up since very early morning just to try and deliberate on this matter. As the chairman has said, we as the medical profession are in great mourning, and it's a situation that has resulted in us as doctors of this country to review our options in the fight against the COVID-19 pandemic. Since the declaration of the pandemic in our country, Kmpdu has rallied its members to offer their services to all Kenyans. These services have been offered in extremely difficult, draining, hazardous, and injurious working environments. COVID-19 is a public health emergency that has placed an extraordinary burden on our profession. And the work environment of frontline healthcare workers is an issue of global concern. Governments across the world have come out in full support of their healthcare workers. In our country, the neglect and working environment has resulted in the loss of now over 30 healthcare workers, 10 of which are senior specialist doctors, and this is a great loss for this country in this war against COVID-19. As a union, we condole with the families of the following colleagues. 1, Dr. Adisa Lugaliki was an obstetrician gynecologist, was the first doctor to succumb to COVID-19 complications in July. Dr. Ndambuki Moloi, a senior pulmonologist. Dr. Daniel Alushula, a senior orthopedic surgeon. Dr. Vladimir Shukin, who has his private practice in this same building that we have our offices. A bariatric surgeon. Dr. Hudson Inyangala, a public health specialist. Dr. Imara Ashraf, a plastic surgeon. Dr. Robert Ayisi, a senior pediatrician and administrator. Dr. Hudson Alumera, a periodontal surgeon. Dr. Faith Mbuba, a pharmacist. And Dr. Jacqueline Joroge, a physician. Kenyans, these are 10 senior doctors who have impacted the lives of many citizens of this country. The unfortunate bit is that the healthcare system and the government has failed them at their utmost time of need. Some of these doctors have had to be moved from county facilities to Nairobi. One had to die in Nakuru awaiting ICU space in Nairobi. As doctors, we have fundraised to ensure that they get treatment that is required, the drugs that are required, very expensive drugs. All this while, the government has not been involved actively in providing and catering for their medical treatment. In fact, out of the 30, there have been bills of up to 2 million of ICU care, of healthcare workers. Those bills have been sorted through fundraising by all healthcare workers, not the government. And over the last 8 months, we as Kmpdu have continuously engaged all relevant government ministries, parastatals, Council of Governors, the legislature of this country, Parliament and Senate, and followed all relevant channels in employment and labor relations in a bid to address the plight of our doctors. If you remember, we initially said that as Kmpdu, industrial action was an option that was off the table. However, due to the neglect of the plight of healthcare workers and the current situation where we've had the highest number of infections amongst healthcare workers and the highest number of mortality in as much as one day, the union has been forced to review its options. In reviewing those options, we convened an emergency special National Advisory Council to deliberate on the long-standing unresolved issues, which I will talk about. But before I talk about, I will give the resolution. The National Advisory Council of Kmpdu, comprising of all top branch leaders of the regions in the entire Republic of Kenya, have today resolved to issue a 21-day strike notice to the government of Kenya. We don't have 49 governments, we have one government headed by a head of state. And the following are the irreducible minimums. 1. Provision of standard and adequate PPEs in all healthcare facilities in the Republic of Kenya. Doesn't matter it's private or public. This is now government responsibility. 2. Comprehensive medical cover for all doctors, public and private, in the Republic of Kenya. 3. Workman's compensation for all doctors and other healthcare workers. 4. Employment of 2,000 doctors out of employment and a review of the contract terms for those engaged in COVID-19 to permanent and pensionable. 5. Enhancement of the existing risk allowance paid to doctors. 6. Dedicated healthcare facilities for healthcare workers in each of the 47 county governments and the national government. And we are not talking about beds. We are talking about highly equipped healthcare facilities with ICU space adequate, high flow oxygen, provision of air evacuation for any doctor who will require it from whichever part of this country. That cost must be borne by the government of Kenya. And lastly, due to the persistent and neglect of the plight of healthcare workers, a constitutional health services commission, not for the doctors but for all healthcare workers. This strike notice will expire on the 6th of December 2020. And I would like to say this in conclusion. 1, to the judiciary. We know that you have been used to order healthcare workers back to work. This time round we are very, very clear. Our lives as frontline soldiers is our constitutional right. We are the soldiers in this war, and if you issue orders against this notice, then that order shall be a piece of paper. And equally to the ministries and agencies such as the SRC. We know you have frustrated healthcare workers. You are currently in the process of even frustrating more healthcare workers. This burden shall be on you, and the blood of all these doctors and any other doctor who dies shall equally be on you. To the political class, doctors are the frontline healthcare workers and the soldiers in this war. If this war is not important to you, then it means our lives to us. And if you're not going to support us, if you're not going to support us and start saying that you're playing politics with Kenyans' lives, it is you who are playing politics with Kenyans' lives. We took an oath, and you equally took an oath of office and held to uphold the Constitution of Kenya in public service. We have done our responsibility. The responsibility is now on you to ensure that Kenyans have access to healthcare workers during this time of the COVID-19 pandemic. And to our beloved President Uhuru Kenyatta, we know you listen. We know that you hold healthcare dear to you. And we say this: we first and foremost thank you for the directives on the plight of healthcare workers. And more importantly, we thank you for creating the Emergency COVID-19 Fund board that has worked with us in this journey and ensured that healthcare workers in the 68 designated COVID-19 facilities, isolation and treatment centers, have access to quality and standard PPEs. However, the people in the Ministry of Health, and here it is two individuals who are leading the ministry. One, Senator Mutahi Kagwe, and two, PS Susan Mochache. Mr. President, these two officials have failed you, have failed healthcare workers, and have failed Kenyans. They have declined to engage health sector unions in this matter. We have written letters, we have called for meetings, but these two individuals have remained adamant. And our verdict is that they are not fit to hold office as leaders of the Ministry of Health. With that said, we appeal to you to look into this matter, because it is our lives. And our lives as doctors will not be sacrificed in this manner. Doctors will not engage in a suicide mission in the war against COVID-19 in Kenya. All the entrepreneurs who resulted in loss of funds, in the stalling of distribution and buying of PPEs at KEMSA, this is equally on your blood. Let no Kenyan be lied to that doctors are the problem here. We are smart people. We are not stupid. And we have solutions that we can give for the betterment of this country. And we have done that before through various initiatives, and sometimes even through hard-fought battles on the streets. And that is where we are going. Kmpdu, to these two individuals, the Ministry of Health, is a constitutional body through Article 41 of the Constitution of Kenya. Labor issues are not issues to be ignored. I think with that said, our message is very clear, and we thank you, the press, for always supporting Kmpdu. Thank you. Any questions?
My name is Tom. What do you mean by suicide mission? What is the current situation, working situation for healthcare?
Tom, you don't need to answer. You don't need to ask anymore. This issue is very emotive. We have come out several times. We have given 10 briefs here on what needs to be done. PPEs, we've written to the Ministry of Health in June to convene a meeting for us to deliberate a way forward on the occupational safety, welfare and health of workers. PPEs are lacking in all other facilities apart from the 68 facilities I said, and that is government's responsibility. Treatment is the responsibility of the government. So, it is clear what I mean by suicide mission. I think I don't have to answer that.
Another question. The CS, again, when appearing before the Health Commission, said that he has written a letter to Cancer allowing them to sell the PPE to current market prices. And that, to that effect, those PPEs have been lying in the warehouses for a couple of months. Are you okay with that direction that the CS is taking? And again, as you answer that as a result, it is concerned that NHIF is not going to cover COVID-related treatment, and the justification is that it's expensive and not viable. What do you have to say to that?
What I have to say is this. On treatment, whatever government decides, whatever they decided that NHIF will not cater for the cost of not just doctors but also other Kenyans, is abdicating their responsibility. Their responsibility, as you have said, is to provide comprehensive medical treatment for the doctors and Kenyans. There's no point in collecting taxes, deducting deductions from our salaries and other Kenyans contributing to NHIF if NHIF cannot cater for this. So I think that is very clear. The internal processes of whether they will buy PPEs from KEMSA is now not our concern. Our concern is PPEs on the ground, quality, and you know, the saddest thing is that those PPEs have been stuck there for months. I think, Elfas, you've gone there with even the Parliamentary Health Committee. We are yet to know who was the orchestrator of this, because that single thing of tenderpreneuring is what has resulted in lack of PPEs equally. One of the main things. So government, counties and national are now saying, because COVID fund has provided PPEs, there are enough PPEs, but not providing PPEs in these other facilities. That is not acceptable. Yes.
Let me add something. Yes. Let me add something on the issue of NHIF. The collective bargaining agreement between Kmpdu and the employer is very clear that the employer shall provide a comprehensive medical cover to all members of Kmpdu. And as SG said, for us to contribute money for treatment of doctors who have been admitted in various health facilities is very absurd and a very solid situation for this country. That you have doctors who every day they are working day and night to ensure they save the lives of Kenyans. But when they fall ill, the government or the employer who they work for cannot cater for their treatment. That you cannot afford the services you offer yourself. That's even paining for a government official to pronounce themselves that they cannot treat doctors, they cannot pay for the treatment of doctors. When any country is in war, when the soldiers get injuries in the field, the soldiers are carried by the government and taken to facilities of treatment, and the government caters for all costs. What about doctors? What about the healthcare workers? Are we less important? When people are going around and calling for meetings and therefore having super spreader events, when those people get sick, they are coming to the hospitals. You are burdening the healthcare workers. And when they fall sick, they are on their own. It cannot continue like that. It can never be business as usual. And healthcare workers, and we have consulted across all other unions. All healthcare workers, in the subsequent days, they are going to issue the same notices, and all facilities will be closed until such a time that the government becomes responsible enough to take care of its citizens. This burden cannot only be borne by the healthcare workers. This is a burden for the government, and it is the responsibility of the government to do their work.
One thing I'd like to add. We have gotten information that now the government is sending a delegation to Cuba to go and get doctors. We'll say this, and I said it earlier. Whoever is advising the president on that, stop misadvising the president. We have doctors out of employment in this country. You have not fully taken care of them, but you're going out of the country to get doctors. Give them better perks than your local foreigners, local doctors, and then come and say that Kenyan doctors are not patriotic. That is a lie. To the public, do not be lied to that Cuban doctors are better or care more for you than us. We have relatives in this country. This is a very painful decision because equally we have our own individuals, our own brothers, sisters who are at risk of getting COVID-19. This 3-week period, we are available for consultations, deliberations to resolve this issue. But as I said earlier, if the government will start its usual way of blaming us, taking us to court, taking us through conciliation, then bringing more doctors, that would be the wrong path to take. And remember, it is our lives now first that matter. So if you threaten us in any way, I go to work, I will die. That is the line. We have drawn the line. It's our lives. And those lives matter. Doctors' lives matter in this country. Thank you.
Just one more question. Could you paint a picture for Kenyans? Just how stretched are the resources available to doctors in the hospitals at the moment? We've talked about PPEs. Are you then purchasing your own PPEs from your own pocket in terms of oxygen and other equipment that is required to, for you to be able to effectively treat COVID patients? Just how overstretched are the resources available to you at this particular moment?
Yeah. Thank you for that question. The resources are very stretched. And some of the experiences we've gone through are very personal, where some of us, including myself, have had to frantically call facilities to get ICU spaces for people who are known to us, and there's no space for critical care. It has to be expanded. PPEs, and I said, we really thank the Emergency COVID-19 Fund. We thank all the donors who supported Kmpdu, M-Pesa Foundation, GlaxoSmithKline Kenya, for at least providing PPEs, basic PPEs, to our doctors. And even individual Kenyans who've taken up the responsibility of fundraising and at least availing PPEs for the doctors. For us, buying PPEs began earlier on. It improved, but now it has gotten back to where we started. You're buying PPEs, you're paying for your own treatment. In home-based care, doctors, nurses, clinical officers are really suffering because even the basic supportive medication is not available to them. You have a family, and most of us have families to take care of. We have extended families. So it cannot be business as usual, because if indeed these are the soldiers, you do not send the soldiers on the battlefield without armor, without guns, and then you're saying, we are clapping for you. We'll forever remain indebtful to you. But then, we are dying. Let us put those words into action. I think I'm clear. Naam kaka, niambie.
Tumeona nchi nyingi kule Europa zimefanya shughuli ya kupitisha shughuli nyingi maarufu lockdown. Hivi kwa ujuzi wenu wa kina kirefu, tunaweza mshauri Rais Kenyatta afunge nchi ama
ugonjwa ulioko sasa hivi umeenea kila county. Kwa hiyo hata ukifunga kwanza, kuna watu wanahitaji chakula. Na umeona pia nchi hizo za bara Ulaya na Amerika wanaotaka kufunga, nini inatokea? Maandamano, si ndio? Si mmeona hayo? Sasa kufunga sio suluhisho. Suluhisho ni kuhakikisha kwamba wafanyikazi wa afya wanapewa vifaa bora, wanasiasa wanapunguza mikutano yao, na serikali inaweka rasilimali za kutosha katika ugonjwa huu wa COVID-19. Kuhakikisha kwamba hospitali zetu ziko na oxygen ya kutosha, kuna ambulance za kutosha, wafanyikazi wa afya wako sawa kabisa, hawana shida zozote. Tukifanya hivyo na tuelimishe Wakenya kuhusu ugonjwa huu, waweze kuelewa, kila mtu atachukua jukumu pia la kuhakikisha kwamba wanajikinga. Unajua kitu ambacho kimeharibia serikali na Wakenya huko nje wanasema ni kwamba hizi namba zinazoenda juu ni ishara kwamba tunataka tena kula pesa. Hayo sio makosa yetu sisi. Hayo ni makosa ya wale ambao walipewa mamlaka ya kuhakikisha kwamba janga la COVID linaweza kukabiliwa vilivyo. Ni makosa walifanya, kwa hiyo warudi kwa Wakenya waambie ukweli. Na hakikisha kwamba Wakenya wataweza kuamini ugonjwa upo na sio kuwatisha wala kutumia polisi. Haitasaidia. Ukimwambia mtu alale njaa ama nunue mask, atatafuta chakula, hata nunua mask. Kwa hiyo huo ndio ukweli wa nchi yetu. Right? Thank you. Yes. Vaccine should be a priority to even healthcare workers. And when you hear news that a country says they have vaccine that is perhaps 95% effective, you should not rubbish that. You should reach out to that government, ask for the relevant expert evidence, and come up with a strategy of even partnering. And the issue of vaccines, and I'll say this, is that there's going to be a very big clamor for vaccines. And countries in the global south, including Kenya, will have a difficult time accessing those vaccines. If you look at the projections of vaccine production, we might be getting those